Hello, guys. I'm Dr. Shelley Glover, and welcome to another Friday at 4 o'clock Surviving COVID episode. I am a board certified gynecologist specializing in anti aging, hormone balancing, and wellness. Once again, I'm located in Central Florida, approximately 20 minutes west of Orlando, in Clermont, Florida. And I have been coming on every single week to kind of help go over the things that have occurred with COVID over the last week, and to help provide as much information as I can provide in this constantly changing environment. As we know, things change every single minute. What was true yesterday may not be true today. But we just kind of together kind of work through it and try to get the best. I try to get you the best information that I'm aware of, and I certainly, as I've always said, am open to anything that anyone else wishes to share as well. So I'm not by any means trying to profess that I am an expert. I just take the data and give it back to you. So, one thing, last week I did say that we were going to discuss. I was going to have a panel and try to discuss the back to school situation. Unfortunately, for those of you that are in Central Florida, you know that the situation is changing drastically every minute. And so I haven't been able to get anybody. My crew kind of fell apart for a couple of reasons. A, because they didn't want to come on and give quote unquote wrong data. And also just because now everybody's scrambling and everybody's really, really busy. So to bring you up to speed, we were supposed to delay opening in for the public schools in Orange County, which is where my daughter attends school, until August 24th, while they were trying to still figure out what was going to go on. There were supposed to be three different modules, either kids being able to go back to regular school, kids being able to do virtual school for the whole year, or a hybrid program where they would do virtual school for 9 weeks and then once again be able to choose whether they wanted to go back to brick and mortar or whether they wanted to stay virtual. So what happened just a few days ago was the decision was made to let schools start on August 10th, which was our original start date, which is, as you know, coming up really quickly. And what will happen is all of the public school children in Orange County will start virtual for 9 days, not 9 weeks, 9 days. And then after that, while they're getting everything situated, then those that are choosing to go into the regular school will go into regular classrooms. At least that is the plan as of today. Stay tuned for Monday because that may change. And I know that a lot of people from around the country are looking at Florida because we are one of the first schools to go back. So we shall see how it works. I have talked to several people within the school system, and just to clarify why there was a switch back to August 10th, first of all, number one, I have been advised to let you know that if you do go to the Orange County Public School website, there is an extensive question and answer where everything is detailed and you may read to your heart's content. And so that's where the latest information is and where they're constantly updating. So that is where you should go to get the most accurate information. However, having said that, the main reason why things were pushed back is because that is our normal school calendar. And going back and starting on, on the 24th instead of starting on the 10th, that would have completely disrupted the whole schedule as far as teacher planning sessions, days off, etc., etc. And so then we would have this lag. Then, plus, we obviously don't know what's going to happen once the school starts. So then we would already be almost 2 weeks behind. And then you turn around, and then, heaven forbid, if they have to close because of the pandemic later, what's that going to do to the school schedule? Also, just from an economic standpoint, the teachers were then being delayed for 2 weeks, and what that was going to do to affect the school system's income, or however that works, not their income, but what their money allotment and how that money is dispersed and the teachers pay, etc. So that's why we doubled back onto August 10th. if I explain that as well as I can. If there's any teachers or other people on the call that want to chime in, they are more than welcome to. But that's where we are with the Florida school situation, and that is why you get me and you don't get our group. Now, if I can lasso a group together in the next couple of weeks, then certainly we will have a segment where we talk about going back to school, because it is a very scary, very concerning, very interesting thing. So I think that is going to just be constantly unfolding. But our kids are resilient, and I think that right now it's still an individualized household to household decision. Some kids need to be in brick and mortar schools. Some parents are opting, if they have that as an opportunity and are able to keep their kids at home. And I think that there's no right or wrong. It's just how this is going to play out, and we're just going to watch and we're going to see. And as Dr. Fauci said, we're going to be the experiment. So hopefully it's not a bad experiment. And like I said, kids are resilient, and no matter what, they will get through this. It's we, the adults, that need all the pampering and the hand holding. So, what are the numbers for this week? Let's see. So in worldwide, our COVID cases, we're at 17.3 million cases across the world. That is up from 15.5 million last week. So we're talking over a million more cases, well over that, almost 2 million more cases in a week. So obviously not where we want to see it, obviously not flattening. Worldwide. Deaths, we're up to 674,000. That's up from 634,000 last week worldwide. Now, we also have 10.2 million survivors compared to 8.87 million last week. So, the good thing is, once again, we have a lot of people that are surviving. However, we have, a lot of people that are also dying. Within the United States, we're up to 4.59 million people, and 155,000 deaths and 2.24 million survivors. We'll go over the other states real quick. California is still leading, and once again, these are not races that we want to be winning, but California is leading in the number of cases at 494,000, so literally almost 500,000 cases of COVID in California, and primarily being centered down in Southern California more than Northern. And the deaths are 9,009, so very, very high on the death rate, higher than, not the death rate, the death toll, the total number of deaths, and that is higher than anyone else by far. So they are definitely having a difficulty time out there. Florida, we are in second place with 470,000 cases and 6,843 deaths. Texas is third as far as the number of cases, and they have, so all three of us, Texas, Florida, and California, have bypassed New York at this point. Texas has 432,000 cases, and what's of interest is they actually have more deaths than we do in Florida. So even though we have more cases, they have more deaths at 6,984. And that data, just so you know, when I was looking, I know that the Florida data was actually worse for today. So I haven't been able to get a hold of the Texas data. So those numbers they're not going to be less. If anything, they might be a little bit actually higher than what I just reported. And then New York was at 419,000 cases with 32,000 deaths. So still, obviously, way more people died in New York than we are seeing elsewhere. And a lot of that, once again, is due to the fact that when the pandemic hit New York City, we have a densely populated area there. We have a lot of people that rely on public transportation, live close together, commute together, work together in high rises, and we're talking elevators, very close contact situation. Also, we did not have the information that we do on things that we are able to use to treat the COVID, so that once people became severely ill, a lot of those people unfortunately died from the disease. So some of the death decrease in the number of deaths, comparatively speaking, even though there's more people now in these other states that are positive for COVID, the reason why you're not seeing, thank God, the death toll that we saw in New York is because of all of these advances. the numbers in Florida, like I told you, we're at 470,000. That's up from 402,000. So an additional 70,000 people, 68,000 if you want to be exact, people diagnosed with COVID in the last week. The death rate has gone up. Not, I'm sorry, guys. I keep saying the death rate. The number of deaths has actually gone up by over 1,000 in the last week. In the state of Florida, we have 6,843 deaths, up from 5,653. The number of survivors is also up, 955,000 compared to 857. Hospitalizations are still up at 26.5 thousand compared to 23,000. So what does that mean? So if you've been watching any of our briefings, you have heard the governor and some other people say that we appear to be flattening. What's happened in the last just 2 days is that we've seen a little bit of a plateau in the numbers. Okay, but the number of deaths is still going to be going up, as I mentioned previously. What you're seeing is that the deaths come after the number of cases. So we had the huge spike, what, 2 weeks ago, and so and then it kept going. So what we're seeing now is the deaths coming from that, because people don't get diagnosed usually and then unfortunately immediately die. And so you're seeing there is always going to be a lag in from the diagnosis to the actual death. So that's what we're seeing now. And they did have the largest number of deaths in the United States about 2 days ago, and it was, I don't want to give the wrong number, I have it somewhere in front of my face, but I can't see it. So when I find it, I will tell you. So it's something that's still evolving. Let's not, even though we have had just a couple of days where we've, in Florida, where we seem to be maybe flattening a little bit, by all means, this does not mean, oh, great, now we can go back to doing, whatever we want. Once again, one of the reasons why we may be seeing a little bit of flattening is that people are finally taking heed, starting to pay attention to their distancing, to the mask wearing, to avoiding large groups, to not being out. The Miami has really cracked down on all of those kind of things, and so we're just seeing a curb and positive results from these things occurring. But it doesn't mean, once again, that we go back to business as usual. It means we continue to do the things that appear to be maybe helping, so that we can try to continue to curb this disease. Correct? Good. So let's see. Let's go over local data for my people that are actually in Central Florida. Orange County, like I told you, where I actually live, we are at 28,000.6 thousand cases, 830 hospitalizations, up from 690, and then 216 deaths. The median range of age is 36. Florida overall, the median age is 40, and the biggest amount, the biggest number of positive cases, though, is still in the 24 to 34 age group in the state of Florida. We have over 92,000 cases in that age group, just so you know. Lake County, we're up to 4.48 thousand cases, 220 hospitalized, up from 183. So almost, 37 more cases in the hospital. And remember, Lake County is much smaller than Orange County. And then we did see a significant bump in deaths in Lake County, from as well as Orange. So from 51 up from 38. And whereas before, Lake County had been kind of holding a little steady for a couple of, for a week, they had been 36 and only had 2 more deaths at 38. But now we've suddenly seen a bump to 51. The median age in Lake County has been running along with the state at 41. I tried to look at the data for people of color versus non-color, and the data is not very good right now. We've got a lot of people that aren't classifying what they are, so the non-classified is really large, so it's kind of hard to get all those numbers but it looks like of the data we have that about 14.7% of the people testing positive in Orange County in Lake County are African American. The Hispanic is about 15 to 17%. Orlando Regional, there are three hospital systems, as I've told you before, primarily in Central Florida. One of them is Orlando Regional, the other one is Florida Hospital, and then the other one is Sanford Medical Center. The Orlando Regional is seeing about close to 300 hospitalizations with COVID, but that is really better than it was 2 weeks ago. They were at 493, so they've actually seen a decrease in the number of hospitalizations. So that's a good thing. They have over 150 of the COVID positive patients in Orlando Regional are over the age of 65. So remember, there's 300, so we're talking about over half of them are over the age of 65. And then they have approximately 21 that are under the age of 39. So yes, it's still occurring. Young people can be hospitalized. They just had on the news the other day about a woman who was 28 years old that had to get a double lung transplant. So she's alive, but it's not that you cannot be severely ill if you're young. Even though, yes, the older you are, the higher the risk, right? Okay, so the U.S. is still worldwide. The U.S. is still has the most number of cases and deaths. Brazil then is second, India, and then Russia. There's the number I was looking for. There were 1,244 deaths reported in one single day in the United States on Tuesday, and that was the highest number of deaths recorded on any one day. Now, if I would say recently, because I know in New York they were having way more deaths than that at the height of the pandemic. So let's say since this, it's not really a second surge because we never finished the first one, but since the numbers started to go up higher elsewhere in the country. As you probably know, Representative Gomer out of Texas tested positive for COVID. The Speaker of the House has now made mask wearing mandatory in the House office building. It was already had been recommended, but now it's actually mandatory. Herman Cain, a well-known Republican who attended the Tulsa, Oklahoma Trump rally, did contract COVID soon after that and did die after a month fight with COVID-19. The U.S. Open Golf is going to be held, but there aren't going to be any fans allowed. My understanding, and I didn't double check it, is that the same thing will be similar with tennis. But I know they just had a tennis match, and there were some spectators in the fans, so in the stands. So they may be more doing the enforcing the physical distancing for the tennis. The numbers are still climbing in all of the states. The only state that's actually green is Vermont. But the red states, as you know, are kind of situated down in the Sun Belt primarily, although Michigan just started to have a really big hike, and they have started to crack down and go backward on some of their reopening steps because of that. The vaccines, you've probably heard that there's, obviously we're in a race. Everybody's in a race to get a good vaccine that we can administer to the public so that we can try to fight this on that level. Russia actually is stating that they have one, that they are going to start administering to the public. They're going to start with frontline workers and then distribute it, and they have lots and lots of it, millions of it that they're going to be employing. They're also going to be giving it to some other countries, and I can't tell you exactly who they are. One thing to be aware of is that they have not done the level 3 testing that normally is done before a vaccine or any kind of medication is released, and so they're basically so that's one of the concerns, of course, with vaccines being released too quickly is, yes, there may be positives, but we certainly do not want the negatives to outweigh the positives. So it will be interesting to watch and see how this goes, and only pray that it is a positive outcome for the citizens in Russia. As far as within the United States, we have 8 different vaccines. There are probably more people, but the government is backing 8 different companies who are working on these vaccines. There is promise in that arena. However, we still are looking, they're thinking for any kind of significant amount of people in the public to be vaccinated. We're looking at the end of the year still. Into next year. And like I said, it's really, yes, we want a vaccine, very, very important to have a vaccine, but what's even more important is to make sure that it's a good vaccine, and we don't want, once again, the cure to be worse than the problem. So there are issues if you rush things too fast. The interesting, with Italy, that's one of the countries that's doing actually really well. And also within the United States, Arizona was actually starting to escalate, and they seem to be starting to flatten their curve. And so, what do the two of those places have in common? Mandatory face mask. And so, there's still all that controversy out there. And my what I say is that yes, if the world is all healthy and everybody had excellent immune status, then maybe masks would not be required. But considering that that's not the case, and the majority of people, especially unfortunately in the United States, because of our diets and our lack of exercise, we are not the healthiest bunch. And so masks will come into play because they protect you as well as me. So you're protecting, when you're wearing that mask, you're protecting other people, even if you don't think that you have it. And if nothing else, if none of this data and these other people that, hopefully that, if you haven't seen anybody close to you with COVID, you're very blessed. But that you kind of are catching on that it doesn't, there's no COVID thing on your forehead that says that I have COVID. So we all think that we're negative, and luckily the majority of hopefully will be, but the people that are positive are all shocked and awed and amazed. I haven't yet to have anybody come to me and go, oh, yeah, I knew that I wanted to get COVID. I mean, come on. And remember, the transmission is out there and is transmittable before you get symptoms. So it's not that you stay away from people that are sick. Sure, stay away from people that are sick. That's common sense. But also, you just have to protect yourself. And until we have anything better, the safest protection is still going to be wearing the face mask at this point. So the everyone knows about there's a hurricane coming, and so it has been upgraded from a tropical storm to a category 1. It is due to hit Florida over this weekend, so there are some things in place. Luckily, we are mainly the governor's been focusing in on the nursing homes and the convalescent places, etc., to make sure that they have the supplies that they need, so that the residents are not displaced. And it's just for you people that aren't in Florida, category 1 is not that bad usually. It can cause some damage, but it's not to the point where people need to evacuate usually. And it's just going to provide a lot of rain and some flooding, and probably a run on our stores for all the yummy goody foods, and as well as water and the things that we need to for surviving if we lose power. So that's the big thing, is losing power. The medications, we went over it. I know that there has been a video that has been out that went viral on Facebook, and I guess it has now been pulled, where there's a group of physicians speaking once again to the hydrochloroquine with the zinc and then the erythromycin, and it being a cure for COVID. I think that the key thing is to remember that there's lots of medications out there. I mean, anyone that knows me knows that I am very much into alternative therapies. I do think outside of the box. I don't um, I use lots of different things and get really good results. So I think that, there are always going to be people that are implementing certain things in their practice that may work well for them, but that doesn't mean that you can extrapolate that out. And you still have to, once again, utilize the studies. It's the same thing. I could come up with a vaccine and think it's the wonderful and give it to 100 people and they all do fine, but that doesn't mean that if we extrapolated out and we gave the same thing to a million people that it would be the same. So that's where the data is. And with the hydrochloroquine, there is data out there, and so far it's not that anyone's saying that it can't help people. It doesn't seem to be the end all be all. It does work with malaria, but it did not work before with the original SARS. They actually tried it, it didn't work well. And so the problem when you have healthy people and they're just coming down with COVID, the question is, we know that a lot of people will recover from COVID on their own. And so are they recovering because they've been put on that regimen? It's possible. Are they recovering because they were going to recover on their own? That's possible too. So we don't know. So it's not that I am not anti any therapy, and I think that once again, I am very much into boosting your immune system, getting you as healthy as possible, picking things that are not dangerous to you and can help you. I am all for that. And working with your physician, if you feel like you want to utilize, if you become positive with COVID-19 and you feel like you want to utilize certain drugs that you've heard about, then certainly make an appointment with your physician and go over it. And that'll be a decision one-on-one that you have. But just realize that there's anecdotal data versus set data, and that once again, as I've said before, this virus unfortunately has taken a major um, 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 political view, et cetera, that has really kind of made it kind of morph differently. And so just be aware of that. So anyway, the medicines that we do know that are working, and so once again, things are changing constantly, and as they see that things are working, they are using it. And just so we know, they are using hydrochloroquine, and they are using zithromax, and they are using zinc. A lot of hospital systems are still using it. They're just not seeing the results that they're seeing with some of the other things that are panning out to be way more effective, like the remdesivir, like the dexamethasone, which is a steroid to help to suppress some of the out of control immune system, like the convalescent plasma, which is still kind of on the teeter totter. They're seeing some mixed results with that. I happen to, as you may or may not know, I do a lot with platelet-rich plasma, so I'm very familiar with utilizing plasma for treatment, and I would definitely tell you that personally, that one I really like, and I really when I have people close to me that I know that are getting positive, that are in the hospital and are at that level, that's one thing that I recommend. But that's me personally. I'm not saying that it's a cure. I'm just saying that it is something that I know the healing properties that can occur. And the nice thing is that it's your blood, and so it's nothing foreign. Now the convalescent, obviously that is different. That's a little bit, you're getting someone else's, but the antibodies, to me, that's a good thing. So the and then of the proning, they're basically once again putting people face down, and they're finding that actually significantly helps relieve the congestion in the lungs and allow for better breathing. So simple things that can help and have been proven to work. So it's not that the medical community is digging their heads in the sand and not doing things. They're certainly working voraciously to try to come up with things to help people be COVID-19 survivors. The the um, the other thing I wanted to talk to you guys about is, like I told you, we're going to kind of focus in on different individual things that are known to kind of help boost your immune system that once again are not perceived as dangerous. And so one of the things is vitamin D. And it's getting a lot of attention now because that is one of the things that has been mentioned as something that can help to boost the immune system in the face of COVID-19. But for those that know me, I've been a strong proponent of vitamin D for, oh my God, well over 15 years. Vitamin D, and that one is studied. You can actually pull up medical studies on vitamin D. So this is not something that is just being thrown about. Vitamin D is a fat soluble vitamin that, yes, is readily available over the counter. It is good for. We all know it for bone health, of course. It helps to drive calcium into the bones, and so we've used it a lot for osteoporosis and just for overall bone health. But it does have a lot of other benefits. Having used it extensively in my practice, it's really actually good for inflammatory processes, definitely helps to boost the immune system, and because it helps with the inflammatory processes, it actually helps with aches and pains, because what happens when you have arthritis or you have one of the autoimmune syndromes like rheumatoid or multiple sclerosis or whatever, you end up with the achiness, and the so the nice one of the nice side effects of vitamin D is it actually helps with muscle aches and joint pains. It also an anecdotal thing, when you put vitamin D, you can get it in a capsule and you can get it in a liquid. There also is injectable where it could be given in an IV, but obviously that's not something that you're going to be able to get your hands on readily. There's also a prescription D. Now the prescription D is synthetic, and it is D2. Your body makes D3. Anyone that knows me knows that I'm a big proponent of giving your body what it recognizes as its own. One of the problems that I feel that we have is, once again, all of these synthetic things that we then our body has to try to figure out what to do with. And so your body has to be able to take this D2 and convert it over to D3 so that it can utilize it. It cannot utilize D2, and unless it is converted over. So my thought process is always, why not just give yourself what you need, which is the D3? So that is my recommendation for that. And that, because of that transition, that's why the D3 is actually way more effective in the body than the D2. So why not take it? So that's what I recommend. A daily dose of vitamin D3 versus the prescription dosage that you can get. Now, that's completely, once again, something that you have to decide with your physician. It's not that I'm anti vitamin D2. I want you to get D. That's the most important thing. So how you get it is up to you. Well, why can't I go out in the sun? Why can't I just get some D out there? You can. You should. We've talked about that before. I am very into sun therapy. I want you out in the sun, not just for the D, but also because it's just it's nature, and we need to be with nature because it's a natural de-stressor. So, like I said, go out there, ideally barefoot, be one with nature as much as you can. Now, the problem is that we have to be careful with safety, right? So, Tamika is asking, how much vitamin D do you need? Yeah, I I dose my clients much higher in the D, but I also follow levels. So I don't want to give out medical advice. I would say that what the recommended daily dose is 800, and I think that's too low for most people. But I can't actually give you numbers because that would get smacked on the hand. So I definitely have some opinions on that, and you certainly are welcome to do a consult if you like, but I can't give you those actual numbers. It's something you would have to discuss with your physician if you want to go higher. But the goal is to D ranges from when you check the levels in the blood, it ranges anywhere from 30 to 100. If you are actually deficient, that is really a big problem. But even if you're in the low ends of normal, the recommendation is actually to be in the higher ends of normal. So you want to be really more in that 70 to 100 range on your blood test versus the 30 to 40 range, and obviously when you actually 30 to 50 range. So when you come into the 50 to 70, you're in that middle zone. But a lot of people will tell me that their vitamin D levels are normal, and then when I check them, like they're 32. And so yeah, you slid into normal, but normal's got a big range, and I prefer it's much better than being low, but you're still not going to get as many benefits as you do when you're higher. And this is, once again, this is not a trial or anything like that, but I can tell you in my personal experience with my clients, especially those that have arthritic symptoms or autoimmune syndromes, that they feel significantly better as far as their aches and pains when their D levels are in the higher range than when they're in the lower range. The D when your D is absorbed through your skin, there's a couple of barriers to that. One is sunscreen, of course. So we want to wear our sunscreen because skin cancer is actually, is one of the number one cancers. People don't realize it because, thank God, besides melanoma, which it can be obviously fatal, most people do not die from the run of the mill skin cancers. But it's still something that can be disfiguring and left to itself. I mean, we don't know, and it's not like you can't have serious illness from skin cancer. So we do want you to protect your skin. So that decreases your absorption. If you are a person of color, the darker you are, the melanin is protective for you, but it also decreases your absorption of vitamin D. So you could be out there all day long, and if you're extremely dark skinned, your D level could be still extremely low. So it's not that I recommend that you get some sunshine. There are people that say 5 to 10 minutes without sunscreen every single day is safe. We live in Florida. The sun can be pretty brutal depending on where you are. Also, are you at the beach? Are you at home? You get the reflection off the water and you can fry real fast. So I'm a proponent of just taking your D. You can go to a tanning booth. I can tell you, you go to a tanning booth, your vitamin D levels will be beautiful. But there's some negatives that go with tanning booths, so I'm not going to recommend that either. But I can tell you, when I see someone and they've got great vitamin D levels and they don't take it, invariably they've been to a tanning booth. Those are the kind of the ways that you can kind of get your D up. And because the supplements are not expensive, it's not a difficult way to get your D. Now, having said that, can you OD, quote unquote, on D? No, you won't die, but you can get toxic on vitamin D. Unlike some vitamins that are what we call water soluble, which means that they go straight out through your kidneys, vitamin D is fat soluble, so it means it stays in your fat stores. So you can build up levels. So you have to be careful, especially if your physician does put you on prescription D, and then you decided that you're going to really be gung-ho and you're going to go out and you're going to get some extra vitamin D and you're going to take that on top of it. You can actually become toxic. And the symptoms vary, but it's not something. So if you're going to be on high dose D, once again, you need your levels followed. I'm aggressive with my D, but I also follow my clients and I make sure that their levels do not go into the toxic range. So there's a fine line to play in that. So that's why you don't want to just go out and just start consuming massive amounts of vitamin D if no one is checking your levels. What else with vitamin D? How does it just so you know, they've used D for many different things. It helps to promote the good killer T cells. It helps to decrease the more inflammatory T cells. It helps your body to fight off viruses and bacteria. And they even used it. They were using it and didn't even realize it with leprosy and stuff, because what did they do? They would put you out in the sun. And so of course the reason why the people were doing better was because they were actually going out in the sun and they were getting their vitamin D. The other thing they were doing is they were giving them oh dear God, cod liver oil. Once again, cod liver oil is very high in vitamin D, and so that's something you can do naturally. That I can tell you, if you're open to that, that's a way for you to get your vitamin D level as well. And so they found that once again, these patients were doing better, but one of the reasons was because they were actually getting vitamin D in different ways. Oops, I just drew a blank because we were talking about the cod liver oil and all of that. So the D, as I mentioned before, you can use it in a capsule that you take every single day. The nice thing is they're nice and little. Not like that. No, excuse me. They're really little, like little pearls. They're little pearls. And so they're usually very easily swallowed. You can also get a D liquid. It depends on the liquid. And um, uh, it should not have a taste ideally, because when it does, it's pretty nasty. And if you put it directly in your mouth, one of the neat side effects is it can help you sleep more soundly. And that's once again just a neat little side effect that I and a couple of other colleagues who utilize it a lot kind of found out about, and so it's kind of nice, and I use that as a natural way to help my clients sleep. So what you don't want to do is put D directly in your mouth during the day, because that could actually make you tired during the day. So if you're gonna do D in a liquid form, you want to drink it. So meaning not like this. I mean, put it in, like, say, some water or something like that. And I don't recommend something this big because this is 32 ounces. So say you don't finish it, then your D is just kind of floating around. So normally what I say is take something smaller and put if you're going to do the D, drop the D liquid in there. Use that maybe to take your vitamins or whatever, and then you got your D for the day, and then you can drink more water afterwards. But if you're gonna put the D, like I said, directly in your mouth, then do it in the evening, and it's nice because it puts you into a little bit of a deeper sleep. It's not an Ambien or anything like that, thank God. So you're not gonna be comatose or anything like that. It's just a nice little side effect that it can make you sleep more soundly. But then you usually wake up and you feel more refreshed in the morning. What else with D? Let's see. Do I have anything else to share with vitamin D? I think I told you the D3 is about 4 times more potent than the prescription one. The Oh, I know this is completely unrelated. So if anybody has any questions about vitamin D, by all means, you can direct message me, or as I've said before, we can do a consult for you if you're interested in some helpful ways to help boost your immune system. Please be aware that nothing that I'm telling you by any means, shapes, or form am I telling you that anything that we discuss on our weekly meetings is putting you at Kanisha is a cure for COVID. So please, I don't need my Facebook live shut down or anything like that. So please don't misconstrue anything that I say. Everything that I give you guys is actually just helpful suggestions. And as always, you should contact your physician for one-on-one care. A little neat side effect that I did want to tell you guys about, just because it's a little interesting to me, because I'm a gym rat. I have not been working out in the gym because of the concern. That's me personally. I don't feel comfortable being in the gym, even though I do, work out in a gym that has open access. And is in a warehouse situation with open bays and stuff. I just personally don't feel comfortable at this point with Florida's numbers the way they are, so I have not been doing it. But one of the things that we do when we weight lift is we actually use the hand chalk, and so they do have some hand chalks that are out there. They used to be about 45% alcohol. They have some that are actually out there that are about 80% alcohol, so they're seeing that might be providing somewhat of a barrier during workouts and stuff. So that's promising. I thought that was kind of interesting. It's not necessarily in place of hand sanitizers. You still should use your hand sanitizers. And once again, that can be just, you can make your own. And there's lots of videos on YouTube for that. So it's not, because obviously you're not going to walk around with chalk going all the way around your hands. That wouldn't be a pretty picture. But just know that that's something interesting and neat that's out there. So it's just one of those things to just show you that people are constantly thinking up new things during this pandemic. And that's one of the neat things, is that I think that it has changed the way we think. And I think that there can be some positives with that. So coming up with new creative ways to deal with different situations, and that's one of them. So anyway, it is now 43, almost 44 minutes in, and as I told you, I'm trying to keep these things shorter and shorter because I do respect your time, and it is Friday afternoon. So if there are no questions on vitamin D or on what we've already discussed, then I'm going to let you guys go, and we will see if I can bring the back to school situation together. If I can get some people together, we will discuss that next week. If not, I will pick another supplement that has some potential for boosting your immune system, and we will discuss that. And I will see you guys later. Have be safe if you live in Florida and you're get prepared for our lovely hurricane that's coming our way. If you don't, if you're on the Eastern Seaboard, I'm sure you're gonna get some of this rain. But enjoy your weekend. As always, stay healthy and stay safe.